Welcome to Mom and Mind, a podcast about maternal mental health, from conception to pregnancy and postpartum. Real stories from moms and family members who have made it from struggling to wellness, and interviews with experts and advocates who work for moms and families to get the help they need. We discuss very real struggles that can sometimes be hard to hear, but these are stories that need to be told so that moms and families can know that healing is possible. This podcast is meant to offer information and awareness and is not a replacement for treatment by a professional. Thank you for being with us today. Welcome to Mom and Mind. I'm your host, Dr. Kat. Today, we have Crystal Clancy on our episode. Crystal is a licensed marriage and family therapist with a private practice in Burnsville, Minnesota. She specializes in perinatal mental health, stillbirth and pregnancy loss, and infertility. She is a co-director and one of the founding members of Pregnancy and Postpartum Support Minnesota, which is also the Minnesota chapter of Postpartum Support International. Thank you so much for being here, Crystal.
Thank you. Very excited.
I'm excited too. So please tell us a little bit about yourself and how you got into this work.
I had my own postpartum experience back in 2005 after the birth of my second child, and I did not have any issues after the birth of my first, and that's a question that I always get. And at that time, I was already in grad school. I had actually completed all of my schooling, all of my internship, and 2 weeks before she was born, had taken my federal exam. So thank God, because afterward, I was not in any shape to be doing any of that. So, it all works for a reason. Anyway, so I was already on my way to becoming a therapist, and I went through infertility with my first, and so that was an interest for me, and grief and loss. But then after going through postpartum depression, getting my first clinical job, I met with some other mental health professionals who also had a similar interest and recognition that there were no awesome resources in our area for this topic. And so we very grassroots for several years sat around a table, met once a month, and formed Pregnancy and Postpartum Support Minnesota, and which I'll just call PPSM going forward because it's a mouthful. And it took quite some time. So that was in 2006 that formed, and we were founded. Suzanne Swanson, who's a psychologist in St. Paul, she spearheaded that whole effort. But there were a group of 6 of us who met every month, got that going. In 2010, we developed. I was the co-developer of the helpline, which was the first one-to-one peer support model in the state for perinatal mental health. So it was very exciting. We've had our challenges along the way. In 2014, Lisa Cross and I became the co-directors of the organization after Suzanne retired. And so since then, that's been us. We've just been really working hard to find out what resources there are, work to develop more, build a volunteer network, and continue with the peer support helpline.
Wow. So just between the two of you guys are making this happen, and then volunteers?
Well, we still have a steering committee of 6. So, Lisa and I are the co-directors, but we still have a core group of 6 of us who run, we all have, we've become more like a real organization where we all have different roles now. We have a volunteer coordinator, we have a membership coordinator, we all have actual roles where kind of everybody has their thing. And so, but the focus is perinatal mental health, and yes, and then volunteers that help us out with events, with outreach, things like that.
Well, that's great. So you must be seeing a lot of people are coming to you then, since your organization has been able to grow.
Yeah.
You must be helping a lot of people.
I'd like to think so. And then we've built a really great network of provider resources that we have listed on our website that we've had providers who either we've met with that have been working in this area, or we've had providers who've approached us wanting more training that we've created trainings for. So yeah, it's definitely growing. We are still pretty limited to the Twin Cities area. That's definitely still an issue to not have enough resources in outstate areas, but long-term goal to do that.
Right. Okay, great. I'm so glad to hear that you guys are doing the work, and I know, every state and every city needs their own local supports, and it sounds like you guys are really the support there in that area,
Mm.
which is really great. So today I'd love to talk to you about screening for depression and screening for other things, maternal mental health related, and why that's important and how it works and all the nuts and bolts of screening. If you can, that give our listeners kind of an intro into the screening process.
Sure. So the reason why this is an important topic is because there has been a huge discussion about the importance of screening pregnant and new moms, but also dads, which is a whole different show. Um,
Mhm.
and and so we've come far enough now that the American College of Gynecologists is recommending screening. The American Pediatric Associations are recommending screening. However, when we look at how often screening is even happening, the statistics are dismal. There are
Mm.
very few providers. Well, I shouldn't say very few, but statistically, it's not as much as we would like to see providers who are actually screening for a variety of reasons. And
Mhm.
and again, this is just it's such a new area that we really need to be focusing on, and also not just hammering it home to providers that they need to be screening, but also educating the users of medical services, which is everybody, and a lot of
Right.
pregnant women and postpartum parents, that they need to be advocating and telling their doctor that I
Mm.
something is up. I was not screened, and that's not okay. And so that's really
Yeah.
the only way that things are going to change, in my opinion, is if we work together to speak up about it.
So in terms of the screening itself, what does that look like? How much time would it take a mom or a provider to well, first, how much time would it take a provider to give the screen and someone to fill it out and stuff like that?
Yeah, that's a really great question because typically, just like with any other screen, most people will say now when they go to the doctor, even just for a annual checkup, they'll get some kind of a little depression screening. It's just becoming standard practice, which is great. So specifically for perinatal, the screening is very similar. It's anywhere from 2 to 10 questions. Typically, providers give it to the person. To fill out in the waiting room. So it's more, again, depending on variations, language barriers, cognitive delays, depression, all of that. It could take a little bit longer to fill out the assessment, but most people, it just seems to take a few minutes to
Mm.
go through the questions. They're multiple choice. As far as providers, then they don't that way if they do it that way, they don't need to be spending time during the session doing the actual screening. They can spend
Mm.
time looking it over and having a dialogue with their patient about it, which more often than not is not happening. So there again, it just emphasized that this really, even if there is an issue, it isn't the screening itself is not something that needs to take a lot of time.
Okay, so there's a couple different kinds of screens out there. If a provider were listening and thinking, okay, maybe I should think about screening, what is this thing? Where would they find them?
Google. And it's that's screening again is not an exact science. Some providers will say we're just using the PHQ-2, which is 2 questions about depression. Some of them use the PHQ-9, which is 9 questions, but the one specifically that's the most validated for perinatal is the Edinburgh postnatal depression scale, which is free. You can print it off online, and you don't have to be a doctor or a healthcare provider to do that. If you're a mom or a dad or worried about someone who just had a baby or is pregnant, you can go online and Google this assessment and click on the checklist, and there are even some online. A lot of them are just PDFs that you can print off, but some of them are click boxes where it will give you a score and just kind of say, oh, you're kind of on the border, you should be concerned, blah, blah, blah. So I really like it's so accessible. It's just people, I think they just don't know that it's out there.
Right. That's true. So that's why I think it's important for us to be talking about it and for you to kind of give it a breakdown so that it is more accessible, just even in our minds, but also to know that it's literally on the internet for free.
Yeah.
Um,
And you don't have to be a doctor to understand it. You can print it off and
right.
anyone can do it.
So, in terms of the kinds of questions that it's asking, what are they geared towards?
So the with the Edinburgh, more specifically, most of the questions are about how you've been doing since having the baby. So again, sometimes the language needs to be tweaked if someone is still pregnant, if or if there's been a loss. Sometimes I will just give it verbally and tweak the questions. But again, you can do that on your own as well. But the questions are asking things about, have you felt sad or depressed? Have you felt like things are not as enjoyable? Do you feel like you're not really enjoying your baby? And then, they ask things about sleep. They ask, even, getting to question number 10, which asks about if you're having any thoughts about hurting yourself or thoughts of death. I'm trying to remember the exact wording, but it's assessing for safety concerns, which, unfortunately some moms do experience. And so it's a really important, it's not perfect, but it's the best of what we have to get a conversation started.
Right. And I think that's a good point. It's kind of getting an idea of what's going on to get the conversation started, but this doesn't mean a diagnosis.
Right.
It doesn't mean something specifically. It's like a heads up.
Yes, and that also connects well with the being aware of that the screening is just one piece. I know so many moms who I've worked with who have said, yeah, my OB gave me a screening, but we never talked about it. And even if they measured high on it, that there was a concern if the borderline is 10. And so if they scored above a 10, they're my doctor never mentioned that, or they just put it in my chart. And so there again, that's also the important piece of taking the time to just look it over. And even when I do that with clients, I don't necessarily go question by question. I may look at it and say, oh, it says here that you may not be enjoying things the way that you once did. What does that mean to you? Or I always ask about the safety as well, even if they say no, because a lot of times moms will say, I lied. I lied on that assessment.
Yeah.
But they also will often say, no, I don't want to hurt myself and I don't want to die, but I've had thoughts about running away and never coming back. Or I've had thoughts like, if I went to bed tonight and just died in my sleep, that would really be okay. And so, saying, okay, so they're not actively suicidal. However, they still they're not enjoying this at all. They're needing some extra support and just need a place to be able to say those things. And again, so that's just one example of why it's important to have that dialogue.
For some providers, anyways, and from what I've heard, say, well, there's just not enough time, or there's some kind of excuse for why they shouldn't be doing this. What would you say to that?
I would say it doesn't have to take a lot of time. Again, the screening itself can be done prior to the session. There could be a couple highlights from the assessment touched on that should be being asked in a postpartum visit anyway. A lot of times with postpartum moms, I used to just pop into a mom's group that ran in my office. I wasn't running it, but it would be going on, and I'd just pop out and just say hi to the new moms and how are you doing? And out would come the tears, and that doesn't necessarily mean they're clinically depressed. But again, it doesn't take much to get get it going sometimes. So as far as time, I do think a couple options would be to say it really does not, again, it doesn't take that much time, but it
Mm-hmm.
also, you can't afford not to do it, because if your patient leaves and something bad happens, which is a risk, you're
Mm-hmm.
liable for that. That's one thing. I mean, the unfortunate hard part of being a healthcare provider, but the other part is also you can also put a different system in place so that if you don't have time during that actual session to talk about it, some clinics will do something like have another staff member who says, could you stay a couple minutes after? There's a couple questions on here that concern me, and I just would like you to talk with someone here about that. Or
Mm-hmm.
could I know one OB clinic that does follow up phone calls. And so they'll say, if they have a high screen, they'll say, could I have my nurse call you tomorrow and just talk with you about a couple things on here? Because, unfortunately, I don't have a lot of time to talk about it, but I want to make sure that we address this because it concerns me. So even just letting them know that, you know, many moms will feel dismissed by
Yeah.
being screened and nothing being done with it. Which also, so to the defense of the providers, when they're asked why they don't screen, it's not always about time. A lot of times it's about, I don't know where to send them if there is a problem. And if they don't live in an area
Yeah.
where there's a lot of resources, or any resources for that matter, they say there's an ethical dilemma with screening and then saying, oh,
Mm-hmm.
have a nice day.
Mm-hmm.
Sorry you're feeling like hurting yourself. So it's a
Right.
it's a systemic issue. It's not just a one part. I don't want people to hear that this is all the doctor's fault and problem to fix. So again, it's why we need to
Right.
all be
Right.
a village of how can we fix this problem.
So, in part, reflecting back on some of the work that you do in your local area, then you have a resource list.
Yes.
You have
Yeah.
people to refer
We're very
to
lucky.
on a list. And in conjunction with Postpartum Support International, since you guys are also a chapter of them, then you also have access to this bigger, broader support system
Hmm.
internationally if that's needed. But at least you guys in your area are an organization that people can reach
Yes.
out to and even say maybe, oh, I don't know what to do with this patient.
Right.
Please help.
And I mean, I really honestly think there's no excuse. Even if you live in a rural area where
Mhm.
you cannot think of a single therapist that has worked with postpartum depression or anxiety or loss or
Mhm.
whatever, or the
Mhm.
mom doesn't have transportation, there are still
Mhm.
resources. There are home visitors. There are support groups, like, again, our peer support. Most people do have access to a phone these days. Everybody, no,
Mhm.
but
Yeah.
most people do have access to a phone. Not everyone has access to the
Right.
internet, but if they do, again, there are
Right.
online support group options. There are options that are available to most people. So even if you may not live in an area where that face to face is abundant, there's still something that you
Mhm.
can do. And often even just validating mom, it's amazing how many, and I don't, you probably experience this too, but how many moms from session 1 to session 2 come in and they say, I feel better just because you told me I'm not going crazy, or because you told me that
Yeah.
I'm not a bad mom, or because you told me that I'm not going to feel this way forever. So sometimes even just
Mhm.
having anybody say to them, we're going to get you through this. This is temporary, might be all they need.
Yes. Right. Oh, that's so true. It does. It
Mhm.
happens all of the time. And and so I think then the screening could have a really positive impact that way. That I think you mentioned,
Yeah.
some moms do lie, and even for my own situation, I took a
Hmm.
PHQ-9 and I lied about how bad I was feeling. And it's very easy to not
Yeah.
be honest with the provider and sometimes with ourselves, really, that it's hard to admit that
Hmm.
things aren't going well. So, what would be the benefit for a mom for filling this out honestly and for herself, or as truthfully
Yeah.
as
So the
possible?
benefit would be even just speaking your truth, of letting somebody know, someone that you hopefully can trust, how you're doing.
Hmm.
And it's still, you still have power to make a decision about what happens from there, you know. Um,
Yeah,
I think a lot
that's
of
a great
people
point.
fear, if I tell them I'm depressed, they're going to make me take pills or make me go to therapy, or,
Uh-huh.
if I'm having
Right.
scary thoughts, they're going to take my kids away. So again, there of just knowing that that's not always the case. I also could comment on the flip side of that of well, so what if I take it and I lie? Well, then what's the point of screening if
Mm-hmm.
I'm just going to lie? And
Mm-hmm.
I'm sure you could speak to this as well. There's so many moms that I've worked with who have said, yeah, I lied, but just because it was put out there, I still took that home and digested it and kind of
Mm-hmm.
recognized that
Yeah.
there was something going on. And so sometimes you plant
Right.
seeds, or sometimes it helps them have a conversation with their partner about how they're doing, or a
Mm-hmm.
friend or a family member or someone just saying, "Oh, yeah, I'm not okay."
That is such a great point. And you made me even reflect on my own
Yeah.
experience too with that. That was a thought that occurred to me. Like, I can't answer these questions
Mhm.
honestly.
Mhm.
What's that about? And I did take it back with me, and that was part of my own process of kind of putting the pieces in place, because I didn't know what was going on at the time. But that is such a good point, that the transformation and the understanding doesn't necessarily need to happen in that
Yeah.
doctor's office. And you might not get exactly what you need in that doctor's office, but if you can know a little bit more for yourself
Yeah.
what's going on, wow.
Yeah,
That's
and
that's
even
a
how
great point.
validating it is that obviously this is a problem for a lot of people. Otherwise, they wouldn't have a whole screening tool that asks these questions.
Right.
Yeah.
Right? Yeah, there is a whole screening tool. It's been around for a
Yeah.
little while
Yeah.
too.
And it's not perfect.
Uh,
Again, back to that, like it does not do nearly enough to address other issues. I mean, how many moms have we worked with? It would be interesting, to with listeners too, to just say, I wasn't depressed, but I wasn't sleeping, or I was having
mhm,
obsessive thoughts or scary
right.
thoughts, or I worried all the time, or things like that,
Mhm.
but they weren't depressed.
They could have either been not depressed at all, or a
Mhm.
mildly having mild
Yeah.
symptoms, or anxious. The screening doesn't always pick up on the
No, no. And
anxiety.
that's one of the pitfalls of screening, and why it's also important to not just give moms the screening and not have a conversation about it. Um, because you
Yeah.
can, even without having the perfect screening tool, you can still incorporate questions into your dialogue. So, for example, if it's asking about sleep, which is kind of a dumb question, anyways, I always get a laugh out of that. Like, I just had a baby. Of course, I'm not sleeping, kind of thing. But of even like, so tweaking how the question is asked, but of if they're anxious, of saying, so when if you get up with baby in the middle of the night and feed him or her, when you go back to bed, are you able to fall back asleep pretty quickly? That tells a lot
Mhm.
right there about anxiety. Right away, you might have a mom who's like,
Yeah,
no, I get up 5 times to make sure they're still breathing. And
right.
oh, okay. Or they might say, no, it takes me a while. Well, why is that? Well, because I lay
Mhm.
there worried about if they're breathing. And so
Mhm.
sometimes I have to get up and
Right.
check if that's the case. And
Mhm.
and so again, just kind of like, you would not get at that information just by saying, oh, thank you for doing this screening.
It sounds like the most important pieces are offering the screening, giving the screening. For this is for providers, is to give the screen, and have one or two resources on hand to
Yes.
refer a mom to. But after you give the screen, to ask some follow up questions, or at least address it on some level. Like, I see that some of these symptoms are bothering you. Do you feel like you need help or something? Uh, you know, to follow up, so that a mom doesn't feel
Right.
like looked
Right.
over.
Yeah.
Yeah, those seem to be the most important parts. And then for the moms who do take the screens, you mentioned before that there are some moms who would go into an office and they're not screened, they're not even asked the question. And I think part of your suggestion was to be an
Hmm.
advocate for yourself, to have your providers be asking these
Mhm.
questions. What are the kinds of things that a mom could take into her pediatrician's office or OB's office to help them start screening?
I think even just downloading the screen themselves and saying, here's how I'm
Uh-huh.
doing, which I know I'm probably sounding a little like Pollyanna here because anybody listening saying, okay, so when I was depressed, I know I wasn't thinking, I'm going to look on Google and I'm going to print off this checklist and bring it to my
Mhm.
doctor. So I know that
Right.
does sound a little unrealistic, I admit. So I do think a lot of advocacy happens in hindsight, which
Mhm.
again, I know this is something that is years in the making of look how far we've come, but we still have yet so far to go. In hindsight, or
Yeah.
partners also are a huge piece of this because a lot of times partners
Mhm.
are the ones who bring it to people's attention and say, I'm kind
Mhm.
of worried about you. That also
Mhm.
leads into a discussion about pediatrician screening because partners are often a part of that
Mhm.
conversation, that first well check as well. So it gives a chance to address
Yeah.
it. But again, back to kind of the question of how can moms advocate for themselves, especially when they're feeling depressed or anxious? Of just kind of knowing, I feel like a lot of times we as women, we know ourselves so well, but we don't listen to our gut. And if your gut
Yeah.
is telling you, this is not me, or this is not what I envisioned it being like, and I am just not okay with that, that's a sign right there.
Mhm.
Does it mean we're going to slap a label
Mhm.
on you? No, not necessarily, but it
Right.
probably means you could use some support, even if that's a
Right.
mom's group or calling up. I mean, I was so lucky in my experience that, I had a friend who had recently had a baby, 6 months before me. So I could call her and say, is this normal? you know, and she'd be like, no, it's not. Or, yes, it
Oh,
is. And so, like, who do you have in your
yeah.
life that can kind of be that voice of reason? Maybe it's a sister, maybe it's a friend, maybe it's a mom's group, maybe it's the nurse line. So find someone that you can just say, I just am really questioning. Don't ignore your gut.
Mhm. That is a great, great point, and I agree with you that we very often do. And I think you brought up another good point that it's not that, either you take one of these screens or you have a symptom and of something, and that means you have this full blown thing, like, that's portrayed in the
Yeah.
media. Dun
Yep.
dun dun. Like she has this thing.
Right.
There's a spectrum. There are mild symptoms and moderate symptoms and very severe symptoms of each thing that a mom could be experiencing, and it doesn't look the same
Right.
for
And
everybody.
not everybody needs medication, and
Uh,
not everybody, very few moms end up having to go to the hospital. So, again, like I do know that a lot of moms, myself included, don't speak up out of fear. And so, if that is another
mhm,
thing that we can take away from today, is that screening and speaking up should not be, if you feel afraid of that, usually that's an irrational fear response. That's your anxiety or
mhm,
depression speaking, saying, oh, worst case scenario. More often than not,
yeah.
we ask the questions, we get you the support you need, and it usually does not go down that path of the awful things that your brain is telling
Mhm.
you.
That's so true. That's so true. Okay, so anything else, or have we covered all of the main topics of screening?
Yeah, I think, again, I don't know what more I would say about the just the lack of anxiety and trauma questions and anything like that. That's probably would get too
Mhm.
wordy.
Yeah. So most of these screens are essentially built for
Hmm.
screening depression. They may pick up on some anxiety, but it doesn't pick up on all of the aspects of a mom's experience. It's just a way of kind of getting a snapshot of what might be happening, and then an indicator that to
Hmm.
look a little bit deeper.
Yeah.
Okay. All right. Well, hopefully some folks who are listening will consider including screening in their offices or in their practice, just to be getting a deeper look at the women who are already coming in, who are already there right in front of you. And I thank you so much, Crystal, for being here with us today and sharing this information and being an advocate for moms and all the work that you do.
And you as well. Thank you for having me.
By joining us today and listening, you're a part of the growing community of people who are aware and concerned for mothers and families during this beautiful and sometimes very difficult time of life. Please take a moment to subscribe, rate, and review this free podcast so that Mom and Mind can be found by moms, families, and providers who will benefit from hearing our talks. If you or someone you know is having a hard time, help is available. Please look for resources for help at momandmind.com, where you will also find links and information from today's episode. Thank you for listening and being a part of the Mom and Mind community.